Looking to boost your financial modeling skills? The Advanced Financial Modeler Accreditation is designed to help you strengthen and validate your financial modeling skills. In the AFM program, you will become an expert at building a world class three statement financial model of a company from scratch. Learn more by visiting fminstitute.com today.
Welcome to Compound Insights, a podcast by CFA Society New York. I'm your host, Rob Rowan. The wealth management market is exploding. So are the firms that assist the companies in that market. Now, most wealth management clients will, sort of quixotically, spend about as much on their healthcare expenses over their lifetimes as they do putting their kids through private school. Christine Simone, our guest today, founded Caribou CEO to help wealth managers create sensible healthcare planning. Prior to founding Caribou, she had various roles in healthcare positions and started out as a researcher at Vancouver Coastal Health. She is a graduate of the University of British Columbia. So, Christine, welcome to Compound Insights.
Thanks so much for having me here, Rob.
I'd like to start with a question that is probably on the minds of the most of the CFAs who are listening to this podcast. How do you model increases in healthcare expenses when healthcare spending in the U.S. is so volatile? It changes, up 20, down, up 7, up 35 year on year. So, how do you model that?
Yeah, not only is it so volatile from a market and inflation perspective, but it's so variable based off of individual to individual. So the approach that a lot of advisors take today is they use national averages, all the financial planning softwares, they have a little calculator that kind of can help you model those costs. But the truth is that you can't model those costs. Like there is no crystal ball, there's nothing that will predict whether your clients will be healthy for the rest of their lives or have to suffer with chronic conditions, and so on and so forth. So, the way in which we actually encourage advisors to approach healthcare is not necessarily with long term modeling, but actually with frequent revisiting and frequent optimization of those costs, because you can only really get a good snapshot of what the client's needs are, what their costs will be on a year by year basis. Even day to day things change, but year by year is what we encourage advisors to really take as an approach with healthcare spending.
Okay, but because few people know that they're going to have, relatively long-term healthcare needs that might balloon in expense, unfortunately, if they fall afoul of some terrible disease. Does the annual thing really help that, or just know when you're in it?
So the annual part is step one. So for example, let's say I'm still actively employed and have a workplace policy that I only pay a couple $100 for, or maybe the company covers it in full, right? My healthcare costs are actually quite minimal because my deductible is probably pretty low, my out-of-pocket expenses are pretty low, and I'm younger and healthy. So really I don't go to the doctor much. So that those types of costs are how you consider that individual in that moment in time, and you can model that out over the course of how many years you expect this person to stay with that type of insurance coverage. Then they will enter a new phase of their life, like retirement, hopefully early retirement. Maybe they get to retire in their late 50s, early 60s. Then your costs drastically change. So you need to paint a picture of what those costs will be for that client in that stage of their life. And then you can model it out again over however many years. And then the same is true for Medicare. So as your clients are kind of going through these different phases, continuing to optimize those costs because their needs are changing, and then also the market and inflation is always going to be changing too. That will give you the best picture of how to model those costs, because the truth is that the financial planning platforms or online calculators, really the only inputs that they have are age, location, and an insurance type, which is way too high level to get into the granular detail of what clients are actually going to be spending.
I see. Yeah, because I was assuming that people who do this type of modeling probably depend on maybe on some of the CMS data.
I don't think most advisors know what CMS even is or
Okay.
stands for or where to get those.
Yeah.
If you're an advisor listening and I've insulted you because you know what that is, I apologize.
Some of them
Please
probably do.
please reach out to me, but I have never had an advisor reference CMS to me without me bringing it up first. A lot of advisors are actually shying away from this conversation because they don't feel like they have the expertise to address it with their clients.
Right. It also might be not exactly one of your clients' hot points in the when you rather talk about the the returns or something like that. It's a hard conversation to have, because you have to contemplate the end of your life. So so that all makes sense to me. Well, I guess this kind of leads me to the other thing that you all do is you kind of, for lack of a better phrase, optimize insurance coverage. And this is an area I assume most wealth managers don't have any experience in either, because they probably worked for a larger firm on which they chose a one of three policies to go for, and,
Yeah.
and that's it. So, are there specific areas that you look for when you look at a client's portfolio of insurance? Are there places where they typically overpay, or does it just depend on what options they have?
Yeah, there's a lot of interesting behavioral tendencies that come into play with insurance. Like, for example, you'll have individuals who are high net worth and want like the Cadillac of Cadillac insurance, right? But they don't necessarily utilize it to its full capabilities or abilities, or they don't understand what benefits it's really providing to them in comparison to other options that are a fraction of the price, right? So I think there's two parts to optimization. First and foremost, it's education and understanding of what the actual benefits are, what's covered, and what you need access to. To give you two very specific examples, if you are a client with a second home in a different state, or you live in the Northeast in New York City, where your listeners do, and you're used to going to the doctor in New Jersey or Boston or wherever else, that's where something like a PPO that gives you broader network access becomes very relevant and highly sought after amongst those types of clients. But if you're in a rural location, all your doctors are local within the local networks, you don't need to pay the extra cost for that, right? So I think education is really part one. The same would apply for HSA compatible plans. HSAs are a great tax free savings vehicle. I know a lot of advisors have a lot of positive opinions on HSAs, but where they sometimes miss the opportunity to go a little bit deeper is that means their clients will be on a higher deductible plan. That means we need to ensure that they have those expenses available should they need to access healthcare. Because a high deductible on an employer plan is $2,000-$3,000, but on the marketplace it's $12,000 to $18,000. So
Really?
it's a much different risk profile. So if an advisor transfers a strategy of this person's employed and they're on a high deductible plan, great. And then they retire and they say, we want to keep pumping money into that HSA without realizing that they could be responsible for paying $18,000 out of pocket before their plan pays anything. It's a little bit short-sighted. So I think part of optimization is education and understanding the composition of these benefit packages. And then you can get into drug formularies, overspending on drug costs, overspending on, higher deductibles when not necessarily needed because you're having that hip replacement this year or having a baby this year. So that's where the education really goes hand in hand with the optimization, because sometimes a lot of these recommendations can be done almost blindly because there isn't that education foundation from the advisor or the client's perspective.
Yeah, it's interesting, but part and parcel to this sounds like something that advisors would, wealth managers, advisors, et cetera, would be able to use as a differentiator in their lineup from, of their options for a client compared to, say, I don't know, the firm down the street.
Yep, absolutely. This is something that we have found our customers leverage in prospecting meetings predominantly because it helps to justify the fees that they charge. If you're just doing investment management, it's not enough anymore. You need to be going much wider with clients. And even financial planning, estate planning, tax planning, those are all kind of table stakes in the market today as well. So the more you can do for your client, the more you can justify your fee. And hopefully it doesn't mean more work on your plate or more time that you're spending, because there are so many great technology providers that enable you to do these additional value add activities in an efficient way. Hopefully, it doesn't require any extra time. It's just increased value for the client. So it's win-win.
Right, or it's, part and parcel to some of that education and that due diligence process is part and parcel to a new account anyway, right?
Exactly.
So
All that onboarding.
yeah, because you have to do that for the financial planning piece anyway. Yeah, yeah.
Exactly.
Interesting. So, well, so that leads me to this. So, you have exceptionally interesting sort of background because you were, as I said earlier, you were on the sort of science side of a lot of things, and then some organizational work. I noticed you did in your resume. I know your details on LinkedIn. So what led you to found Caribou?
So, like you said, I went to school thinking I would be a doctor. I worked in research. I almost started a master's in neuroscience and physiology. Like I was a huge science nerd. I loved health. Like I loved healthcare, and I think what they do a disservice to students is that they teach you if you love sciences and you love healthcare, you've got three tracks: research, a vet, or a doctor. Like those are kind of the three things that you can be, especially if you have European parents like me. I chose not to pursue that path very early on, and luckily I realized it very early on because I realized that I actually really wanted to like change the experience that consumers had with the system, and I wanted to be on the innovation and technology side of that system. So I joined, a startup. It was a medical device company, and I just absolutely fell in love with how technology can change the healthcare landscape for the better. And since then, there's been no going back. But what I learned across a couple of roles working in health tech companies is that no one within the healthcare system is incentivized to help people or save their money, optimize their healthcare costs, spend less. Your insurance company doesn't want you to switch to another insurance company because it helps you save money. That's not what's in their best interest. And if you think about the way that the insurance landscape works, it's driven predominantly by incentives through commissions. And sometimes those outcomes are not in the best interest of a consumer. So that led me down the path of wanting to build a product that has more of a fiduciary type of angle of, look, we have your best interest at heart. We really want to help you uncover opportunities to save money and to not be worried about healthcare costs in your retirement. Like you said, it's one of the biggest expenses in retirement, and it's the top concern that people have as they're retiring. So that led me to the financial services industry, got talking with some advisors, recognizing the gaps that they had in their tech stacks today, and that nothing was really helping them solve the healthcare problem and really address that in an effective way with their clients. So 3, 4 years later, here we are and, working with thousands of advisors and tens of thousands of their end clients.
Yeah, it's fascinating. I mean, it's part just good old-fashioned business sense, right? So you identified a space where no one was doing anything, and you saw you could make a fee on it. Bing. But I guess the other thing is you're sort of different mentally from a lot of scientists, right? Who dig down into, I mean, especially neurologists. They're numbers, 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 right? So, um, and you're a little sort of altruistic, sort of techie kind of combination of things.
Yeah, well, I think that comes around like numbers in the sense of data points, right? Like researchers need a lot of data points to prove something that it's valid, right? Whereas in the startup seat where I'm at, 1, 2, 3, that's a pattern to me. I'm going after it, right? So I don't need an N of 20, right? I don't need like a sample size that's a
And
certain.
what is in? Yes.
Exactly. Exactly, right? So I think I was a little bit lost, but my passion for healthcare and my passion for science is kind of what kept me, wanting to pursue that. But luckily enough, I realized that there was this alternative path that I could take.
Fascinating. Why did you name it Caribou?
So the caribou, the animal, travels the furthest of any other land mammal for migrations. And so astrologically, they're known to be a guide. And so similarly, we like to think that we are guiding people through the healthcare system, helping them find, their optimal choices and navigate all that complexity. So the name really, I'm not really like a star signs person,
It just
but
worked, yeah.
but the name
Yeah.
comes from that.
Okay, that's fascinating. Well, so thank you for sharing your thoughts and a little bit about the genesis of Caribou with us, Christine.
My pleasure, Rob. I appreciate you having me on and letting me share with your audience.
Okay, and so for those of you listening to the podcast, first of all, thank you for taking your time with us today. And if you're interested in more thoughts from Christine and a little bit more about Caribou, and you are a member of CFA Society New York, you can dial into our website and find a video recording of her session during the Wealth Tech event we had earlier this year. Once again, if you're not a member, please do consider joining because that's the only way you will be able to see that video. Um, so, so thank you all again. This is Rob Rowan with CFA Society New York and this has been Compound Insights.